Hi, today we'd like to come back on the topic of unexplained miscarriages and discuss two of the most common causes that you might have. So we've repeated that unexplained miscarriages are actually not unexplained. It simply means that the doctor that you are currently seeing or the fertility center that you're currently seeing is unable to identify what is causing it. So these doctors will usually recommend that or sometimes miscarriages happen naturally, sometimes unavoidable. Just try for your next pregnancy again. It should be a successful one, don't worry. But then you still miscarry and you still follow their advice and you end up miscarrying 3 to 4 times, 5 times, and then this is already 5 years of your resources wasted with no successful pregnancy. So here at Antai Hospital, if there's one thing we do very effectively is that we treat miscarriages very effectively. We don't say that we can treat all diseases, but what we do specialize in is miscarriage prevention, treatment, and diagnosis. So there's no such thing as unexplained miscarriages in our book. In our book, we know that there's up to 43 individual causes for recurrent miscarriage. If you have 2 or more miscarriages or above, and if there's no doctor that can actually identify the cause to secure you a healthy pregnancy, Antai Hospital definitely can, and we are very confident with it. So back to the main topic, 2 most common causes of unexplained recurrent miscarriages. Firstly, which is the most common one that we see, which is either undiagnosed, not putting enough emphasis on it, or there's completely no awareness. So it's about the uterine shape and size. So either that you have a septate uterus, which means there's a tissue growing on the roof of the uterus. This is affecting implantation, causing recurrent early miscarriage. Septate or a naive uterus. A naive uterus is a uterus that has very small uterine body but very long uterine neck. This can cause the same recurrent early miscarriage. This is common is because many doctors are unable to properly identify and diagnose these 2 conditions. But here at Antai Hospital, not only can we diagnose it, we can offer you effective treatment with up to 95% success rate. All we need to do is just hysteroscopic correction to correct the uterine shape and size. And if this is in fact your underlying cause, you can have a 95% success chance on your next pregnancy after receiving treatment with us. Now we'll go on to the next factor. Now this factor is even more unknown, which is the immunological factor. So we've repeated many times that patients who've undergone several induced abortions in their history, even having a history of miscarriages or pregnancy, you may very well have a presence of this anti-embryonic antibody. Now this anti-embryonic antibody will affect your subsequent pregnancies because these antibodies will latch on to these embryonic cells during implantation, preventing and affecting its development. So it also causes recurrent early miscarriage. Now this anti-embryonic antibody is also the primary cause for chemical pregnancies as well. Now these miscarriages happen far more earlier, and currently many doctors say there's no cause to it. We don't understand it. But Antai Hospital understands and knows that the underlying cause is anti-embryonic antibodies. Now we offer you a internationally patented treatment because we discovered this antibody, and we offer you a highly effective, painless injection treatment to neutralize this antibody and allows you to actually have a stable full-term pregnancy. So these 2 factors is either a problem with the uterine shape and size, which is either undiagnosed or people cannot diagnose properly. We do that here effectively. Second common factor is the immunological factor, where we also do diagnosis easily and treatment. So both these causes can be diagnosed and treated within a day in Antai Hospital with a full refund guarantee. If you do miscarry again, then we offer you a full refund guarantee to show you how confident, how effective these treatments are. Get in touch with us today. Stop wasting your time and resources on your IVF programs or any other fertility programs. Treat the condition at the root cause, and a successful pregnancy can be had.